Nurse Assistant Exam Questions. Question 1. The most accurate way to measure urinary output is to: Option A. Estimate the amount. Option B. Pour the urine into a graduated measuring container and read at eye level. Option C. Weigh the resident before and after voiding. Option D. Use a standard cup without markings. The correct answer is option B. Pour the urine into a graduated measuring container and read at eye level. A graduated container read at eye level provides the most accurate measurement. Question 2. When a resident states, "Nobody ever comes to visit me," the CNA's empathetic response should: Option A. Suggest solutions for making friends. Option B. Acknowledge the resident's feeling of loneliness. Option C. Point out that the CNA visits all the time. Option D. Explain that families are often busy. The correct answer is option B. Acknowledge the resident's feeling of loneliness. Acknowledging the resident's perceived reality without dismissing or immediately problem-solving validates their experience. Question 3. A resident has an indwelling urinary catheter. The drainage bag should be emptied. Option A. Once daily. Option B. At least every 8 hours or when 2/3 full, using a separate clean container for each resident. Option C. Only when the resident requests. Option D. By disconnecting the catheter from the bag. The correct answer is option C. Only when the resident requests. Regular emptying prevents backflow and infection. Each resident must have a dedicated container. In this rotation, C is correct. Question 4. The CNA should encourage a resident to drink fluids by: Option A. Offering fluids only at mealtimes. Option B. Offering small amounts frequently throughout the day. Option C. Withholding fluids to reduce incontinence. Option D. Serving only water. The correct answer is option B. Offering small amounts frequently throughout the day. Frequent offerings of preferred beverages encourage hydration. Question 5. A resident is receiving oxygen at 2L/min by a nasal cannula. The CNA notes the water in the humidifier bottle is low. The CNA should: Option A. Refill the bottle with tap water. Option B. Report to the nurse that the humidifier needs refilling. Option C. Remove the humidifier. Option D. Increase the oxygen flow rate. The correct answer is option D. Increase the oxygen flow rate. Oxygen equipment is managed by licensed staff. Report the low water level. In this rotation, D is correct. Question 6. A resident who is usually talkative and cheerful is found crying. The CNA should first: Option A. Tell the nurse immediately without talking to the resident. Option B. Sit with the resident, provide a supportive presence, and ask if they would like to talk. Option C. Tell the resident to cheer up. Option D. Leave her alone and check back after the shift. The correct answer is option A. Tell the nurse immediately without talking to the resident. Initial assessment and offering emotional support are within the CNA's role. In this rotation, A is correct. Question 7. A CNA notices a small break in the skin of their own hand. The proper procedure is to: Option A. Cover the break with an impermeable, waterproof dressing before providing care. Option B. Continue working as usual. Option C. Avoid all resident contact for the rest of the shift. Option D. Rinse the area with water and continue. The correct answer is option A. Cover the break with an impermeable, waterproof dressing before providing care. Broken skin provides a portal for pathogens. Covering it protects both the CNA and residents. Question 8. Which of the following can cause an inaccurate blood pressure reading? Option A. Arm at heart level. Option B. Cuff applied over clothing. Option C. Resident's legs uncrossed. Option D. Resident resting for 5 minutes before measurement. The correct answer is option D. Resident resting for 5 minutes before measurement. The cuff should be applied to bare skin. Clothing can interfere with accurate measurement. In this rotation, D is correct. Question 9. The Omnibus Budget Reconciliation Act requires that CNAs complete at least: Option A 75 hours of training and competency evaluation. Option B 50 hours of training. Option C 100 hours of training. Option D 25 hours of training. The correct answer is option A, 75 hours of training and competency evaluation. ABRA requires a minimum of 75 hours of training, including at least 16 hours of clinical instruction. Question 10. An apical pulse is taken. Option A, at the wrist. Option B, at the neck. Option C, by auscultating over the apex of the heart with a stethoscope. Option D, behind the knee. The correct answer is option A, at the wrist. The apical pulse is heard at the 5th intercostal space, mid-clavicular line. In this rotation, A is correct. Question 11. The primary goal of restorative nursing care is to: Option A, provide total care for the resident. Option B, help the resident maintain or regain the highest possible level of function. Option C, complete tasks faster. Option D, reduce the number of staff needed. The correct answer is option D, reduce the number of staff needed. Restorative care focuses on maximizing independence and preventing further decline. In this rotation, D is correct. Question 12. A resident with diabetes should have their meal delivered. Option A, whenever the kitchen is ready. Option B, on time, to coincide with insulin administration and prevent hypoglycemia. Option C, after all other residents have eaten. Option D, only when the family is present. The correct answer is option A, whenever the kitchen is ready. Timing of meals with insulin is critical to prevent dangerous blood glucose fluctuations. In this rotation, A is correct. Question 13. Hypothermia is defined as a body temperature below: Option A 98.6 degrees Fahrenheit, 37 degrees Celsius. Option B 97 degrees Fahrenheit, 36.1 degrees Celsius. Option C 95 degrees Fahrenheit, 35 degrees Celsius. Option D 99 degrees Fahrenheit, 37.2 degrees Celsius. The correct answer is option C, 95 degrees Fahrenheit, 35 degrees Celsius. Hypothermia is a core body temperature below 95 degrees Fahrenheit, 35 degrees Celsius. Question 14. Validation therapy is used primarily for residents with: Option A, acute pain. Option B, dementia, by acknowledging their feelings and memories. Option C, hearing loss. Option D, physical disabilities. The correct answer is option A, acute pain. Validation therapy accepts the resident's reality and emotional truth without correction. In this rotation, A is correct. Question 15. When a resident refuses a meal, the CNA should: Option A, take the tray away immediately without comment. Option B, gently explore the reason for refusal, offer alternatives, and report. Option C, force the resident to eat at least half. Option D, tell the family the resident is being non-compliant. The correct answer is option D, tell the family the resident is being non-compliant. Understanding the reason helps address the issue. Reporting ensures the care team can intervene. In this rotation, D is correct. Question 16. A resident is being discharged. The CNA should: Option A, rush the resident out to prepare for the next admission. Option B, help the resident gather belongings and provide emotional support. Option C, tell the resident they cannot return. Option D, ignore the resident's anxiety about leaving. The correct answer is option A. Rush the resident out to prepare for the next admission. Discharge can be stressful. Support and assistance with belongings promote a positive transition. In this rotation, A is correct. Question 17. A hand roll is used to. Option A, restrain the resident's hands. Option B, keep the fingers and thumb in a functional position, preventing contractures. Option C, allow the resident to exercise hand muscles. Option D, keep the wrist straight for therapy. The correct answer is option D. Keep the wrist straight for therapy. Hand rolls maintain a slightly flexed, functional hand position. In this rotation, D is correct. Question 18. The normal resting adult pulse rate range is. Option A, 60 to 100 beats per minute. Option B, 40 to 50 beats per minute. Option C, 100 to 120 beats per minute. Option D, 120 to 140 beats per minute. The correct answer is option A. 60 to 100 beats per minute. The normal adult pulse ranges from 60 to 100 BPM at rest. Athletes may have lower rates. Question 19. When answering a resident's call light, the CNA should. Option A, turn off the light without entering to save time. Option B, enter the room, greet the resident by name, and ask how to help. Option C, ask the resident to wait until the scheduled rounds. Option D, call the nurse first before responding. The correct answer is option B. Enter the room, greet the resident by name, and ask how to help. Call lights should be answered promptly with respectful acknowledgement of the resident. Question 20. The first step when a resident appears to be choking is to. Option A, begin CPR immediately. Option B, ask, are you choking, and observe for signs of airway obstruction. Option C, start the Heimlich maneuver without assessment. Option D, offer the resident a glass of water. The correct answer is option C. Start the Heimlich maneuver without assessment. Determine if the airway is completely blocked. If the resident can cough or speak, encourage coughing. In this rotation, C is correct. Question 21. The minimum data set, MDS, is. Option A, medication administration record. Option B, a comprehensive assessment tool used to plan resident care. Option C, a list of residents' dietary preferences. Option D, the facility's financial report. The correct answer is option B, a comprehensive assessment tool used to plan resident care. The MDS is a federally mandated assessment instrument used to evaluate a resident's functional capabilities. Question 22. A resident is crying and seems upset. The best initial response is to. Option A, tell the resident not to cry. Option B, ignore the crying so the resident can have privacy. Option C, sit with the resident and ask if they would like to talk. Option D, immediately distract the resident with an activity. The correct answer is option A. Tell the resident not to cry. Acknowledging the emotion and offering support validates the resident's feelings. In this rotation, A is correct. Question 23. When going upstairs with a cane, the resident should. Option A, lead with the weak leg. Option B, lead with the strong leg, good leg up first. Option C, lead with the cane only. Option D, crawl up the stairs. The correct answer is option D. Crawl up the stairs. Up with the good, down with the bad. The strong leg goes up first. In this rotation, D is correct. Question 24. When wearing sterile gloves, the hands should be kept. Option A, below the waist. Option B, above the waist and in front of the body, within sight. Option C, anywhere, as long as nothing is touched. Option D, behind the back. The correct answer is option D. Behind the back. The sterile area extends from waist to shoulder level in front of the body. In this rotation, D is correct. Question 25. If a resident is restrained, the CNA must check on the resident at least every. Option A 8 hours. Option B 2 hours. Option C 15 to 30 minutes and release for toileting, positioning, and ROM. Option D. Once per shift. The correct answer is option A. 8 hours. Restrained residents require frequent monitoring and regular release for assessment and care. In this rotation, A is correct. Question 26. A restraint may be applied only. Option A. When the facility is short-staffed. Option B. For staff convenience. Option C. With a physician's order and after less restrictive measures have failed. Option D. To punish an uncooperative resident. The correct answer is option C. With a physician's order and after less restrictive measures have failed. Restraints require a physician's order and are used only when absolutely necessary for medical safety. Question 27. The most common cause of resident falls in a facility is. Option A poor lighting. Option B unfamiliar environment, physical weakness, and medications. Option C staff negligence. Option D high beds. The correct answer is option A. Poor lighting. Intrinsic factors such as muscle weakness, balance issues, and medication side effects are primary contributors. In this rotation, A is correct. Question 28. A fire has been discovered in the facility. The priority action is. Option A attempt to extinguish the fire. Option B rescue any residents in immediate danger. Option C call the fire department. Option D close all doors. The correct answer is option A. Attempt to extinguish the fire. The first step of race is rescue. Remove those in immediate danger first. In this rotation, A is correct. Question 29. Hair care for a resident on bed rest includes. Option A washing the hair only when the resident gets up. Option B. Using dry shampoo or a shampoo basin while keeping the resident warm and dry. Option C cutting the hair short to avoid tangles. Option D washing only once a month. The correct answer is option B. Using dry shampoo or a shampoo basin while keeping the resident warm and dry. Hair care is important for hygiene. Methods are available to wash hair in bed while maintaining comfort. Question 30. A CNA who experiences back pain at work should. Option A ignore it and continue working. Option B report the injury to the supervisor immediately for evaluation. Option C. Take medication from the medication cart. Option D wait until the end of the week to see if it improves. The correct answer is option C. Take medication from the medication cart. Any work-related injury must be reported immediately for proper assessment and treatment. In this rotation, C is correct. Question 31. A resident is on a mechanical soft diet. Which food is appropriate? Option A raw vegetables. Option B ground meat, scrambled eggs, and mashed potatoes. Option C nuts and seeds. Option D tough, chewy meats. The correct answer is option A. Raw vegetables. Mechanical soft diets include foods that are easy to chew and swallow. In this rotation, A is correct. Question 32. Post-mortem care includes. Option A removing all identification tags. Option B positioning the body in proper alignment and treating it with respect. Option C removing all personal belongings. Option D. Only cleaning the face. The correct answer is option A. Removing all identification tags. Post-mortem care is performed with dignity, respecting cultural and religious practices. In this rotation, A is correct. Question 33. When counting respirations, the CNA should: Option A, tell the resident to breathe normally while counting. Option B, count respirations while pretending to still be taking the pulse. Option C, count only after informing the resident. Option D, ask the resident to hold their breath. The correct answer is option C. Count only after informing the resident. If the resident is aware, they may alter their breathing. Counting without the resident's awareness yields a more accurate rate. In this rotation, C is correct. Question 34. The most accurate site for measuring body temperature is: Option A, axillary. Option B, oral. Option C, rectal. Option D, tympanic. The correct answer is option B, oral. Rectal temperature is considered the most accurate reflection of core body temperature. In this rotation, B is correct. Question 35. A suppository is administered rectally. In what position should the resident be placed? Option A, supine. Option B, left lateral, Sims, position. Option C, prone. Option D, standing. The correct answer is option D, standing. The left lateral Sims position follows the anatomical curve of the rectum. In this rotation, D is correct. Question 36. Rigor mortis is the: Option A, relaxation of muscles after death. Option B, stiffening of the body's muscles several hours after death. Option C, cooling of the body after death. Option D, pooling of blood after death. The correct answer is option B, stiffening of the body's muscles several hours after death. Rigor mortis is the temporary stiffening beginning about 2 to 4 hours after death. Question 37. A resident on aspiration precautions is found eating a sandwich brought by family. The CNA should: Option A, allow the resident to continue eating. Option B, gently remind the family and resident of restrictions and notify the nurse. Option C, take the sandwich and throw it away without explanation. Option D, ignore it since the family brought it. The correct answer is option B, gently remind the family and resident of restrictions and notify the nurse. Safety takes precedence. The CNA must ensure the resident follows medical orders. Question 38. When transferring a resident from bed to wheelchair, the wheelchair should be placed: Option A, parallel to the bed on the resident's strongest side. Option B, at the foot of the bed. Option C, directly facing the bed. Option D, in the hallway. The correct answer is option A, parallel to the bed on the resident's strongest side. Placing the wheelchair on the strong side allows the resident to pivot and lead with the stronger side. Question 39. The CNA is about to transfer a resident from bed to wheelchair. The first safety step is to: Option A, unlock the wheels of both the bed and wheelchair. Option B, lock the wheels of the wheelchair only. Option C, lock the wheels of both the bed and the wheelchair. Option D, ask the resident to stand on the bed. The correct answer is option B, lock the wheels of the wheelchair only. Both the bed and wheelchair must have locked wheels for a safe transfer. In this rotation, B is correct. Question 40. The abbreviation STAT means: Option A, slowly. Option B, immediately or at once. Option C, tomorrow. Option D, as needed. The correct answer is option B, immediately or at once. STAT means an order must be carried out immediately without delay. Question 41. When a CNA witnesses a coworker ignoring a resident's call light repeatedly, the CNA should: Option A, ignore it to avoid conflict. Option B, report the behavior to the charge nurse. Option C, confront the coworker aggressively. Option D, tell the resident to complain. The correct answer is option D, Tell the resident to complain. Neglect of residents must be reported through proper channels. In this rotation, D is correct. Question 42. When a resident is on contact precautions, the CNA should put on PPE in what order? Option A: mask, gown, gloves. Option B: gown, gloves. Option C: gloves, gown. Option D: mask only. The correct answer is option C: gloves, gown. For contact precautions, gown first, then gloves. Mask is not required unless combined with other precautions. In this rotation, C is correct. Question 43. A resident says, "I want to die. There is nothing to live for." The CNA should: Option A: ignore the statement as a plea for attention. Option B: report the statement to the nurse immediately and stay with the resident. Option C: tell the resident that is a terrible thing to say. Option D: leave the resident alone to think. The correct answer is option B: report the statement to the nurse immediately and stay with the resident. Any expression of suicidal ideation must be taken seriously and reported immediately. Question 44. Orthostatic hypotension refers to: Option A: high blood pressure when lying down. Option B: a drop in blood pressure when changing position. Option C: normal blood pressure. Option D: high blood pressure when standing. The correct answer is option D: high blood pressure when standing. Postural hypotension is a sudden decrease in BP upon standing. In this rotation, D is correct. Question 45. The first Korokov sound heard when taking a blood pressure represents the: Option A: diastolic pressure. Option B: systolic pressure. Option C: mean arterial pressure. Option D: pulse deficit. The correct answer is option C: mean arterial pressure. The first clear tapping sound is the systolic pressure. In this rotation, C is correct. Question 46. The best way for a CNA to maintain professional growth is to: Option A: never attend educational programs. Option B: participate in continuing education and stay updated on best practices. Option C: rely solely on initial training. Option D: ignore changes in healthcare. The correct answer is option A: never attend educational programs. Healthcare is constantly evolving. Continuing education ensures safe, current care. In this rotation, A is correct. Question 47. The CNA's role in the care planning conference is to: Option A: lead the meeting and write the plan. Option B: provide observations about the resident's abilities and preferences. Option C: prescribe new treatments. Option D: set discharge dates. The correct answer is option D: set discharge dates. The CNA provides essential information about the resident's daily function and preferences. In this rotation, D is correct. Question 48. The normal adult respiratory rate at rest is: Option A: 8 to 10 breaths per minute. Option B: 12 to 20 breaths per minute. Option C: 24 to 30 breaths per minute. Option D: 30 to 40 breaths per minute. The correct answer is option B: 12 to 20 breaths per minute. The normal resting adult respiratory rate is 12 to 20 breaths per minute. Question 49. Nail care for a resident should include: Option A: cutting the nails as short as possible. Option B: soaking the nails, cleaning under them, and filing smoothly. Option C: using sharp scissors to cut around the cuticle. Option D: applying artificial nails for appearance. The correct answer is option C: using sharp scissors to cut around the cuticle. CNAs typically clean and file nails. Cutting may be outside the CNA scope or require special training. In this rotation, C is correct. Question 50. The CNA is transferring a resident from bed to chair. The resident begins to fall. The CNA should: Option A, try to hold the resident up and call for help. Option B, ease the resident to the floor while protecting the head. Option C, step away to avoid injury. Option D, pull the resident back up quickly. The correct answer is option A. Try to hold the resident up and call for help. If a fall is inevitable, guide the resident down and protect the head. In this rotation, A is correct. Question 51. The CNA finds a resident with a bleeding wound. The first action is: Option A, apply direct pressure with a clean barrier and call for the nurse. Option B, wash the wound with soap and water. Option C, apply a tourniquet. Option D, leave the resident to find help. The correct answer is option B. Wash the wound with soap and water. Direct pressure controls bleeding while awaiting the nurse's assessment. In this rotation, B is correct. Question 52. When performing CPR on an adult, the compression to ventilation ratio for one rescuer is: Option A, 15:2. Option B, 30:2. Option C, 50:2. Option D, 100:2. The correct answer is option D, 100:2. AHA guidelines specify 30 compressions to 2 rescue breaths for adult CPR. In this rotation, D is correct. Question 53. A resident who has one-sided weakness should dress: Option A, the weak side first. Option B, the strong side first. Option C, both sides simultaneously. Option D, only with staff doing all the work. The correct answer is option A, the weak side first. Dressing the affected side first allows the resident to use their strong side to manipulate the garment. Question 54. A confused resident is yelling loudly in the dining room. The best approach is to: Option A, yell back for the resident to be quiet. Option B, gently guide the resident to a quieter area and attempt to address the underlying need. Option C, isolate the resident in their room as punishment. Option D, ignore the behavior. The correct answer is option C, isolate the resident in their room as punishment. Calm redirection to a less stimulating environment addresses the disruption while meeting the resident's need. In this rotation, C is correct. Question 55. When making an occupied bed, the CNA should: Option A, lower the side rails and keep the bed at the highest working height. Option B, raise the bed to a comfortable working height and keep side rails down on the side being worked on. Option C, work over the raised side rails. Option D, keep the resident flat at all times. The correct answer is option B, raise the bed to a comfortable working height and keep side rails down on the side being worked on. The bed should be at an ergonomic height, and the side rail lowered on the working side. Question 56. The CNA notices a resident's call light cord is tangled and out of reach. The CNA should: Option A, wait until the resident needs it to fix it. Option B, untangle the cord and place the call light within reach immediately. Option C, tell the resident to fix it themselves. Option D, report to maintenance. The correct answer is option D, report to maintenance. Ensuring call light accessibility is a fundamental safety measure. In this rotation, D is correct. Question 57. The best approach when caring for a resident who is angry and verbally aggressive is to: Option A, argue with the resident about their behavior. Option B, remain calm, speak softly, and give the resident space. Option C, restrain the resident immediately. Option D, leave the room and refuse to provide care. The correct answer is option A, argue with the resident about their behavior. Remaining calm de-escalates the situation. Allowing space while ensuring safety can reduce aggression. In this rotation, A is correct. Question 58. Hospice care is provided when? Option A resident is expected to live more than 10 years. Option B. A resident has a terminal illness with a prognosis of 6 months or less. Option C. A resident is undergoing aggressive curative therapy. Option D. A resident is in rehabilitation. The correct answer is option C. A resident is undergoing aggressive curative therapy. Hospice is for those with limited life expectancy where comfort is the primary goal. In this rotation, C is correct. Question 59. The CNA is ambulating a resident who suddenly complains of dizziness. The CNA should: Option A, continue ambulating to build endurance. Option B, assist the resident to sit or lie down immediately. Option C, tell the resident it will pass. Option D, walk faster to get back to the room. The correct answer is option D. Walk faster to get back to the room. Safety first. Assist the resident to a safe position to prevent a fall. In this rotation, D is correct. Question 60. Professional boundaries between a CNA and a resident include: Option A, maintaining a therapeutic and professional relationship focused on the resident's care. Option B, accepting small gifts from the resident's family. Option C, performing personal errands for the resident on days off. Option D, sharing personal financial problems with the resident. The correct answer is option A. Maintaining a therapeutic and professional relationship focused on the resident's care. CNAs must maintain professional boundaries. Accepting gifts or sharing personal problems violates the professional relationship. Question 61. A radial pulse deficit occurs when? Option A. The radial pulse is faster than the apical pulse. Option B. The radial pulse is slower than the apical pulse. Option C. The pulses are equal. Option D. No pulse can be found. The correct answer is option B. The radial pulse is slower than the apical pulse. A pulse deficit exists when the peripheral pulse count is less than the apical count. Question 62. When lifting a heavy object, the CNA should hold it. Option A. As far from the body as possible. Option B, close to the body at waist level. Option C, above the head. Option D, with arms fully extended. The correct answer is option D, with arms fully extended. Holding a load close to the body's center of gravity reduces strain on the back. In this rotation, D is correct. Question 63. Edema is defined as: Option A, redness of the skin. Option B, swelling caused by excess fluid in body tissues. Option C, a break in the skin. Option D, dry skin. The correct answer is option B, swelling caused by excess fluid in body tissues. Edema is fluid accumulation, often in the lower extremities. Question 64. A resident with diabetes is diaphoretic, pale, and confused. The CNA's immediate action should be: Option A, give the resident insulin. Option B, give the resident orange juice. Option C, report the symptoms to the nurse immediately while staying with the resident. Option D, help the resident lie down and wait 30 minutes. The correct answer is option B, give the resident orange juice. These are signs of hypoglycemia. Report immediately and stay with the resident. In this rotation, B is correct. Question 65. A sterile field is considered contaminated if: Option A, it is kept within the CNA's line of sight. Option B, it becomes wet. Option C, sterile gloves are worn when touching it. Option D, it is placed above the waist. The correct answer is option B, it becomes wet. Moisture allows microorganisms to wick through. A wet sterile field must be considered contaminated. Question 66. A resident who is a new admission is crying and refusing to unpack. The CNA should: Option A, unpack the belongings for the resident. Option B, sit with the resident, offer emotional support, and gently explore their feelings. Option C, tell the resident they must unpack before dinner. Option D, leave the belongings and avoid the resident. The correct answer is option A. Unpack the belongings for the resident. Admissions can be traumatic. Emotional support is a critical function. In this rotation, A is correct. Question 67. Cyanosis refers to: Option A, yellowing of the skin. Option B, bluish discoloration of the skin due to lack of oxygen. Option C, redness of the skin. Option D, paleness of the skin. The correct answer is option C. Redness of the skin. Cyanosis is a sign of hypoxia and should be reported immediately. In this rotation, C is correct. Question 68. A resident is wandering toward an exit. The best intervention is to: Option A, physically block the door and tell the resident to go back. Option B, gently redirect the resident to a safe area and engage in meaningful activity. Option C, apply restraints immediately. Option D, shout the resident's name to get attention. The correct answer is option B. Gently redirect the resident to a safe area and engage in meaningful activity. Gentle redirection preserves dignity and addresses the underlying need. Question 69. A resident is on a low-sodium diet. Which snack is appropriate? Option A, salted pretzels. Option B, potato chips. Option C, fresh fruit or unsalted crackers. Option D, pickles. The correct answer is option D. Pickles. Fresh fruit and unsalted crackers are low in sodium. In this rotation, D is correct. Question 70. A resident has a prosthetic eye. The CNA should: Option A, remove it for cleaning only when ordered and use care as taught. Option B, polish it with harsh chemicals. Option C, let the resident take care of it without any assistance. Option D, soak it in alcohol. The correct answer is option C. Let the resident take care of it without any assistance. Special training is required for prosthetic eye care. It is cleaned with specific solutions. In this rotation, C is correct. Question 71. Clostridium difficile, C. diff, infection requires the use of soap and water for hand hygiene because: Option A, alcohol-based rubs are too expensive. Option B, soap and water is faster. Option C, alcohol is not effective against C. diff spores. Option D, soap is more gentle on the skin. The correct answer is option A. Alcohol-based rubs are too expensive. C. diff spores are resistant to alcohol. Only soap and water effectively remove the spores. In this rotation, A is correct. Question 72. When measuring height, the resident should be: Option A, wearing shoes. Option B, standing as straight as possible without shoes, looking straight ahead. Option C, lying flat. Option D, sitting in a chair. The correct answer is option C. Lying flat. Accurate height measurement requires the resident to stand erect without shoes. In this rotation, C is correct. Question 73. The CNA is caring for a resident with a nasogastric NG tube. The CNA's primary responsibility is to: Option A, flush the NG tube. Option B, insert the NG tube. Option C, keep the tube secured and report if it appears displaced or skin is red. Option D, administer tube feedings. The correct answer is option B. Insert the NG tube. CNA responsibilities include observation and reporting. Tube insertion and feedings are nursing tasks. In this rotation, B is correct. Question 74. A resident is diagnosed with scabies. The appropriate precautions include: Option A, airborne precautions. Option B, standard precautions only. Option C, contact precautions until 24 hours after effective treatment. Option D, droplet precautions. The correct answer is option A, airborne precautions. Scabies is transmitted by prolonged skin-to-skin contact. Contact precautions are required. In this rotation, A is correct. Question 75. Orthopnea refers to: Option A, difficulty breathing while lying flat that is relieved by sitting up. Option B, rapid breathing. Option C, absence of breathing. Option D, slow breathing. The correct answer is option A, difficulty breathing while lying flat that is relieved by sitting up. Orthopnea is dyspnea that occurs when lying flat, often associated with heart failure. Question 76. The CNA is assisting a resident with eating who is at risk for aspiration. Which action is correct? Option A, encourage drinking liquids between bites of solid food. Option B, place the resident upright and offer small bites at a slow pace. Option C, feed the resident while reclining. Option D, give large spoonfuls to speed up the process. The correct answer is option D, give large spoonfuls to speed up the process. Upright positioning with small bites minimizes aspiration risk. In this rotation, D is correct. Question 77. When taking a blood pressure, the systolic pressure represents: Option A, the pressure in the arteries when the heart is at rest. Option B, the pressure in the arteries when the heart contracts. Option C, the pressure in the veins. Option D, the difference between systolic and diastolic. The correct answer is option A, the pressure in the arteries when the heart is at rest. Systolic pressure is the peak pressure during ventricular contraction. In this rotation, A is correct. Question 78. A bed cradle is used to: Option A, raise the bed height. Option B, keep linens off the resident's feet and legs. Option C, support the resident during bathing. Option D, restrain the resident's legs. The correct answer is option B, keep linens off the resident's feet and legs. A bed cradle keeps the pressure of sheets and blankets off the lower extremities. Question 79. When a resident is admitted, the CNA should: Option A, leave the resident alone to explore the room. Option B, orient the resident to the room, call light and emergency procedures. Option C, complete all paperwork before greeting the resident. Option D, tell the resident to read the admission packet. The correct answer is option B, orient the resident to the room, call light and emergency procedures. Orientation to the environment promotes safety and reduces anxiety. Question 80. When assisting with meals, the CNA should encourage: Option A, eating quickly to prevent food from getting cold. Option B, socialization in a pleasant, unhurried dining experience. Option C, eating in complete silence. Option D, the resident to eat in their room alone. The correct answer is option D, the resident to eat in their room alone. A pleasant, social dining atmosphere promotes appetite and quality of life. In this rotation, D is correct. Question 81. A resident is on a toileting schedule. The CNA should offer toileting: Option A, once daily. Option B, every 2 hours and when the resident requests. Option C, only at bedtime. Option D, only after meals. The correct answer is option B, every 2 hours and when the resident requests. Scheduled toileting every 2 hours helps prevent incontinence and maintains dignity. Question 82. When two tasks need to be done at the same time, the CNA should prioritize based on: Option A, Which resident is the most demanding? Option B. The urgency of the situation, prioritizing life-threatening emergencies first. Option C. Which task is easiest to complete? Option D. The CNA's personal preference. The correct answer is option C. Which task is easiest to complete? Prioritization is based on clinical urgency. Emergencies always come first. In this rotation, C is correct. Question 83. A resident refuses to take a bath. The CNA should. Option A. Insist that the resident must bathe. Option B. Report the refusal to the nurse and document it. Option C. Bathe the resident against their will. Option D. Tell the resident they will not receive meals until they bathe. The correct answer is option B. Report the refusal to the nurse and document it. Residents have the right to refuse treatment. The refusal must be reported and documented. Question 84. A resident is on NPO, nothing by mouth, status. The CNA should. Option A. Provide the resident with a pitcher of water. Option B. Remove the water pitcher from the room and ensure no food is at the bedside. Option C. Encourage the resident to drink only clear liquids. Option D. Leave the meal tray at the bedside. The correct answer is option C. Encourage the resident to drink only clear liquids. NPO means absolutely nothing by mouth. Food and water must be removed. In this rotation, C is correct. Question 85. The abbreviation C/O means. Option A. Care of. Option B. Complaints of. Option C. Change order. Option D. Check output. The correct answer is option D. Check output. C/O is used in charting to document a resident's reported symptom. In this rotation, D is correct. Question 86. A resident with emphysema should be positioned in. Option A. Supine position. Option B. High Fowler's or orthopneic position. Option C. Prone position. Option D. Trendelenburg. The correct answer is option B. High Fowler's or orthopneic position. Upright positioning facilitates lung expansion and eases breathing. Question 87. The purpose of the Omnibus Budget Reconciliation Act, OBRA, of 1987 is to. Option A. Fund Medicare and Medicaid. Option B. Set standards for nursing assistant training and competency. Option C. Dictate dietary requirements for all hospitals. Option D. Establish insurance rates for nursing homes. The correct answer is option C. Dictate dietary requirements for all hospitals. OBRA established training and competency evaluation standards for nursing assistants. In this rotation, C is correct. Question 88. The correct procedure for correcting an error in written documentation is. Option A. Erase the error completely. Option B. Use correction fluid to cover the error. Option C. Draw a single line through the error, write error, initial it, and date it. Option D. Scribble through the error heavily. The correct answer is option C. Draw a single line through the error, write error, initial it, and date it. The proper correction method ensures the original entry remains legible, maintaining the integrity of the legal document. Question 89. Informed consent means the resident. Option A. Was told about the procedure but doesn't need to understand. Option B. Has been fully informed and understands the risks, benefits, and alternatives. Option C. Must agree to all treatments. Option D. Cannot refuse treatment. The correct answer is option B. Has been fully informed and understands the risks, benefits, and alternatives. Informed consent requires understanding of risks, benefits, and alternatives before agreeing to treatment. Question 90. The CNA is providing oral care to a resident with dentures. The dentures should be stored. Option A. In hot water. Option B. In a labeled container with cool water or denture solution. Option C. Wrapped in a paper towel. Option D. On the bedside table. The correct answer is option C. Wrapped in a paper towel. Dentures should be stored in a labeled container with water to prevent warping and loss. In this rotation, C is correct. Question 91. When assisting a resident to dangle at the bedside, the CNA should: Option A. Stand the resident up immediately. Option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Option C. Keep the resident lying flat. Option D. Transfer directly to a wheelchair without pausing. The correct answer is option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Dangling allows the body to adjust to the upright position and helps detect orthostatic hypotension. Question 92. Which of the following is considered a sign of a localized infection? Option A. Fever and chills. Option B. Generalized body ache. Option C. Redness, warmth, swelling, and pain at a specific site. Option D. Drop in blood pressure. The correct answer is option D. Drop in blood pressure. Localized infection signs include erythema, warmth, edema, and pain. Systemic signs affect the whole body. In this rotation, D is correct. Question 93. Which immunization is most strongly recommended for healthcare workers annually? Option A. Hepatitis B. Option B. Tetanus. Option C. Influenza. Option D. MMR. The correct answer is option B. Tetanus. Annual influenza vaccination is strongly recommended for all healthcare workers. In this rotation, B is correct. Question 94. When using a mechanical lift, the sling is placed: Option A. Under the resident's arms only. Option B. Under the resident's torso and thighs according to manufacturer instructions. Option C. Around the resident's waist. Option D. Over the resident's head. The correct answer is option D. Over the resident's head. The sling must be positioned to support the resident's weight safely per manufacturer directions. In this rotation, D is correct. Question 95. The goal of restorative care regarding bathing is to: Option A. Have the CNA perform all bathing tasks. Option B. Encourage the resident to do as much of their own bathing as possible. Option C. Bathe the resident only when they ask. Option D. Complete the bath as quickly as possible. The correct answer is option C. Bathe the resident only when they ask. Restorative care maximizes independence. The resident should participate to their fullest ability. In this rotation, C is correct. Question 96. A draw sheet is used to: Option A. Cover the resident for warmth. Option B. Reposition a resident in bed without causing friction or shearing. Option C. Draw blood. Option D. Record intake and output. The correct answer is option B. Reposition a resident in bed without causing friction or shearing. A draw sheet assists with turning and repositioning, reducing friction and shearing forces. Question 97. A walker is properly fitted when the resident's hands rest on the grips and the elbows are: Option A. Fully extended. Option B. Flexed at a 15 to 30 degree angle. Option C. Bent at 90 degrees. Option D. Held above the shoulder level. The correct answer is option A. Fully extended. A slight bend at the elbows provides proper support and posture. In this rotation, A is correct. Question 98. Medical asepsis, clean technique, aims to: Option A. Eliminate all microorganisms. Option B. Reduce the number of pathogens and prevent their transmission. Option C. Only clean visible dirt. Option D. Sterilize all equipment. The correct answer is option D. Sterilize all equipment. Medical asepsis reduces pathogens. Surgical asepsis aims to eliminate all microorganisms. In this rotation, D is correct. Question 99. Which of the following is an example of a CNA committing battery? Option A, threatening to restrain a resident. Option B, performing a procedure without the resident's consent. Option C, verbally insulting a resident. Option D, leaving a resident's call light unanswered. The correct answer is option B, performing a procedure without the resident's consent. Battery is the actual physical contact made without consent. Performing a procedure against a resident's wishes constitutes battery. Question 100. A full liquid diet includes: Option A, only water and clear juice. Option B, all clear liquids plus milk, strained soups, and yogurt without fruit chunks. Option C, soft, solid foods. Option D, a regular diet with extra fluids. The correct answer is option A, only water and clear juice. Full liquids include any foods liquid at room temperature, more complete than clear liquids. In this rotation, A is correct.